Says we're live. I'm just waiting for it to set up the Facebook thing here.
Okay.
Okay, there we go. So good morning. I'm Annette from COVID Recovery Iowa, and with me today is Lisa from the Drake Headstart program. COVID Recovery Iowa is a peer-to-peer counseling program. It's funded through a FEMA grant. And you can reach us at covidrecoveryiowa.org or the Iowa Concern Hotline 800-447-1985, or our warm line is 844-775-9276. Welcome, Lisa.
Thank you.
Can you tell us a little bit about your program and how its Headstarts are set up throughout the state?
Sure. So Headstart and Early Headstart, they are an early childhood education school readiness program, and we promote children's development through comprehensive services that support their early learning, their health, and we also look at family well-being. So Headstart is actually a federally funded program under the Administration for Children and Families. Drake University receives this federal funding through ACF, through the Office of Headstart, in order to provide these services in Central Iowa. So Drake University Headstart also includes Early Headstart, which I'll kind of explain a little bit more. Mm-hmm. We are the largest Headstart grantee in the state of Iowa and one of only a few university-based programs in the nation. We serve families with children from birth to age 3 through our Early Headstart program. And then we serve children 3 and 4 years of age through our Headstart program. Okay. So we are both Headstart and Early Headstart, but you'll just hear me refer to Drake University Headstart, and that really kind of encompasses all of those services. We serve 6 counties in Central Iowa. So we serve Polk County, Boone, Jasper, Marion, Warren counties, and then we also serve Story County, but we serve just the city of Ames. And then another Headstart program in the state of Iowa serves the remainder of Story County. So there are 18 Headstart programs across the state of Iowa. And some have Headstart and some have Early Headstart. So they all might look a little different, but they are all Headstart programs and under that same Office of Headstart umbrella.
Okay. Is there anything that makes yours unique?
Yeah, so several things I think that make us unique, or just a little more about exactly what our program looks like. So Headstart, which is our 3 and 4-year-old programs, we offer those services in center-based or classroom programs across all 6 counties that we serve. And those classrooms, we have some that are half day, so we'll have like a morning and an afternoon session. And we have some that we refer to as full day, which are really about 6 to 6.5 hours a day.
Okay.
So that is available across all of the counties that we serve. In addition to that, though, here in Polk County, we also offer our Headstart center-based classrooms, but we, in addition to those, we offer home-based services. So here in Polk County.
Sorry. Go ahead.
Okay.
Did you hear that background thing?
I did. That's okay. That's how it goes, right? But we do also offer home-based services. And so what that is instead of children coming to a classroom every day, we have a teacher who goes into the home and does a weekly 90-minute one-on-one visit with that child and a parent or legal guardian. And that anybody could apply for that. It just helps. We don't provide transportation as a part of our program. So if that's a barrier for families, we want to be able to meet that need still. So we offer a home-based option. And then in Polk County, that's the only county in which we offer our Early Headstart program, so our birth to 3 services. And again, we do have home-based, and a bulk of that programming is home-based, but we do offer some center-based classrooms for Early Headstart as well for 2-year-olds. And we don't have quite as many of those locations, but you kind of have that choice in Polk County. Birth to 5, home-based versus center-based. And then something else that we offer in Polk County only is we do have an Early Headstart Child Care Partnership Grant. And that's a newer grant It's a new partnership between the Federal Office of Head Start and the Federal Office of Child Care, where we're kind of blending those two. And so we partner with 7 child care sites here in the city of Des Moines. And we sort of layer our early Head Start services on top of the child care services they're already offering. And the intent is to help support child care centers in building a quality workforce and providing quality early childhood settings in a child care setting. So a lot of that grant is around PD for staff, professional development for staff, intensive coaching for staff, classroom supports and materials, and just really helping to make sure that those environments and those staff can continue to build quality in the child care center. And so that's just a new partnership between those offices about 7 years ago, and Drake University was the first grantee in our region to receive that grant. So it's still a newer grant, but very exciting that we can kind of partner in the child care setting as well. And one other unique thing is we partner with the Polk County Department of Human Services and the federal 0 to 3 program. They have established a Safe Babies Court team in Polk County to surround families whose children have been removed by the court system with services to support reunification of that child and parents. And so we have one of our early Head Start home-based caseloads is dedicated strictly to serving those families in that Safe Baby Court team. Again, to surround them with services and help try to support reunification. And so that's kind of a unique program that we offer that we're pretty proud of too.
That sounds like and then do you see like some of these new programs eventually, expanding those?
Yes, in fact, so that early Head Start Child Care partnership, that's just a newer partnership. We were in that first round of grantees awarded. They have, I think it's been about, with COVID, everything blurs together, about a year to 18 months ago, they did offer that again, and they had additional grantees apply for and get that funding. So I do think that that's something that with time, we'll continue to see funding opportunities and more of those Head Start and early Head Start Child Care partnerships. And then even just Head Start, the services in general, it just depends, of course, federal program, federal budgeting, but there are occasionally opportunities to expand programming as well. And so, like I said, Head Start and early Head Start looks different across the state, across the nation, how they offer it, what types of services. If anybody's looking to find out exactly what Head Start or early Head Start services are in their area, they can go to the Iowa Head Start Association website. And that website will give you all kinds of information about the program, but at least in the state of Iowa, then you can actually put your zip code in and it will give you information on the Head Start program that serves your community. And you can connect with your local Head Start program that way.
And that website is iowaheadsstart.com if anyone's interested in that. And we'll put those in the comments when we're done here too, for people to get to that. How has the pandemic impacted your services that you offer?
Yeah, so lots of ways, and probably more than we could spend time on today. But some of the biggest impacts have just been to what our services have looked like over the past year. And believe it or not, it's been a year, almost a year to the day, that we kind of got noticed and we just instantly went virtual with our services. And our services remained virtual through the end of last school year, program year, all summer. This fall, when we sort of returned to our new school year, we did return to in-person services. We've had to reduce our class sizes to allow for social distancing in the space that we have in some of our classrooms. We have a lot of health and safety protocols that are in place. We're temping kids, we're screening kids. Parents are not currently allowed into our classrooms or our buildings, which has kind of changed just kind of that relationship building and that dynamic. And we've had some interruptions to services. We've had some classrooms that have had to close temporarily due to COVID related, whether we've had a couple of positive cases, we've just had to quarantine based on exposures. And and sometimes it's family members, staff's family members, and so staff have to quarantine and we can't even staff a classroom. And then we also, mid-November, I think a lot of schools and programs went virtual again mid-November, and we did too. We're Drake University, and so the university not only took their classes remote, but they closed their offices and all business moved remote, and so we had to go remote. So we were back to virtual learning mid-November through mid-January. And so it's just been a lot of start and stop. It's a lot of transition for our kids and families from in-person to virtual to in-person. And that's been challenging, to say the least. And just that relationship building with kids, with the families. One of the things that I should have mentioned before that makes Head Start unique is we really, we're beyond just preschool. We are a comprehensive 2-generational approach to our services. And so we don't just look at academics, we look at the health and nutrition of the children. We look at their social skills. We're looking at their self-help and independence skills. We're looking at their social emotional wellness. And the 2-generational approach means we're looking at not just the child, but their whole family. And so we also offer needs assessment, goal setting, resource and referral, and community connections to the parents and families of the children. Well, that becomes really hard when you haven't even actually met them face to face, when you're trying to build a relationship virtually. So that's been hard. And hiring has been challenging. We've had some staff vacancies, and we haven't necessarily been able to pinpoint if it's just COVID and people not sure about entering education in this time. But we've struggled to fill some open positions, and we've had some programs, a couple of classrooms that have had to be virtual the entire school year because we just can't staff them. And then enrollment, we've seen a dip in the number of applications and just our enrollment and keeping some of our classrooms full, and that's understandable. Surely there's apprehension about young children in environments like this right now. And so just really kind of trying to keep the word out that we are open, we are here. We have protocols in place to offer safe and healthy environments, and that we are still enrolling and we are still open and offering services. So and I would say, I guess, I was going to say it's been a real challenging year, and I think that has also been one of the biggest impacts of COVID is our staff, just our staff mental health and wellness. So many changes, coming to work in an environment where there's just a lot of unknown around COVID, and wanting to keep the kids and families safe, but also wanting to keep their own families safe, and just the stress that there is, period. And then, so yeah, that has been a real focus of ours too, is just trying to help support staff. And it's been a tough year for them.
For a lot of people.
Yeah.
Would you be willing to speak a little bit about the research that talks about the precursor to the early childhood education and like dropout rates?
Yeah, I can kind of speak
briefly,
broadly and briefly. Yeah. So a lot of research around early childhood, of course, just speaks to, all the brain development that occurs like between birth and age 5. And there's a lot of research around if there are inequities in resources or access to early childhood education during that time frame, that those years are so impactful. And so if you have fewer resources, if you don't have the same access to education, those sorts of things, that can in fact impact you well beyond those years where that brain development is occurring. One of the things that we at Headstart, and especially Drake University Headstart, have spent a lot of time on and kind of used it is ACEs. And I don't know if you've heard of the ACEs study. It's the Adverse Childhood Experiences Study. And it was first conducted by the CDC and Kaiser Permanente about 20 years ago, but it's been obviously administered again and kind of fine-tuned. But it looks at the link between these adverse childhood experiences that a child might have prior to turning 18 years of age, and those long-term impacts. And it looked initially at health impacts, and it showed that for children who had more ACEs or more of these adverse childhood experiences, there were all of these long-term health impacts way into adulthood, higher levels and occurrences of disease, earlier mortality rates, all kinds of things. And that's kind of been expanded. And we spend a lot of time in Head Start looking at trauma. And so the impacts of trauma, which is kind of what these adverse childhood experiences are getting at. And so when there's trauma, when there's these experiences, again, it creates stress for kiddos. And there's a lot of research around chronic stress and again, health impacts, but then also those child development and educational outcomes from that. So we work a lot on trying to build some of those protective factors and work on resiliency building in kiddos and families as a way of trying to mitigate that, because the research also shows that just because you've had an adverse childhood experience or experienced some trauma or chronic stress, it doesn't mean, well, throw in the towel, you know, like that's happened. You can build resiliency and build protective factors that help to then decrease that impact over time. And so that's kind of, again, at that foundation of Head Start, because Head Start is a program that's geared toward low-income families, high-risk families. And so as a part of our application process, we actually look at assessing if some of these ACEs are in place for the kiddos applying for the program as well. And so again, that's kind of what our program is all about. It's about trying to close that gap in accessibility to quality programming and then build on those resiliency and protective factors, so that essentially our goal is that kiddos from lower income or with fewer resources, they're entering kindergarten and they're succeeding in school at the same rate as other families and children. So yeah, hopefully that kind of gets at what.
It does, yeah, it makes the connection that I wasn't necessarily aware was out there. So that's yeah. Good. Anything else that you think parents should know?
I think the biggest thing, there's lots more we could talk about with Head Start. I think what I would like them to know is that we are, again, anyone with a child age eligible for our services is eligible for our program. We are to prioritize families from lower incomes, but that doesn't mean that a family that might be above those income guidelines can't get into the program. Because again, we're looking at more than just income. We're looking at all kinds of factors, and we're taking applications all the time, year round. Our programs might run kind of on a school calendar, but we fill vacancies if we have an opening in the program. And so we're always taking applications and we're always enrolling. And that's the case for any Head Start program. You can apply at any time. And I think that the other message is that whether you're in Head Start or another early childhood program, or your kiddos are at home with you or another provider, the other thing that is a big message for Head Start is that parents, resources are out there. You are your child's first, most important and forever teacher. And so the things you can do, that we're here and we're here to support you, but ultimately as a parent, you're gonna set that stage and you're gonna build those skills for your kiddo for their success moving forward. And so again, that's one of the big things of Head Start is just, if it's not Head Start, just connect with resources. That would be, I think, one of my biggest messages.
Perfect. We're kind of at the end of our time. If there anything else that you wanna mention quickly?
I don't think so. I just want to thank you for the chance to share a little bit about our program and get the word out. And again, you are welcome to share my contact information. It's Lisa Proctor with Drake University Head Start. My email is just my name, lisa.proctor@drake.edu. I'm happy to field questions, help connect to other Head Starts, provide resources. If people are have questions or are just looking for where to go, please feel free to reach out. I'm happy to help.
So perfect. So Lisa's Drake Head Start does Polk, Boone, Jasper, Marion, Warren, and then the city of Ames. So if you can reach out to her for those. And then iowaheadstart.com will get you to that general one where you can plug in your zip code and you can find a Head Start in your area as well. So thank you, Lisa.
Thank you.
Yeah, thanks for joining us.
Yes, have a good day.
Bye. Bye.